Hey, everybody. Welcome back to another episode of Soul Focused Radio. This is your host, Martin Friedman. And once again, I'm extremely excited to be joined by my friend and colleague, Albert Gay. How are you doing, Albert?
Hey, I'm doing well, Martin. Good to be on this part 2 podcast. So I'm doing well, brother. No complaints.
Awesome. You gave us some really great information, last week when, folks listened to your podcast and we got to hear, learn about you, learn about Gary, learn about, some of the history and your relationship to Gary and all of that, a little bit about your family. And, today I wanted to hone in a little bit more on the work that you do. One of the topics that we're really going to be exploring a lot on this podcast is social justice in healthcare in many different ways and many different facets. And what I wanted to focus on with you is I wanted to focus on social justice in public health, specifically racism, how racism plays out in the public health field, because I know that's the field that you work in. And then also we'll talk a little bit about, as the conversation progresses, we'll talk a little bit about, racism itself as a public health issue, social justice, but specifically racism as a social justice issue, and how it manifests as a public health issue. So where I wanted to start today, Albert, is I really wanted to start with just examining, your relationship to the public health field, the work that you do. And let's start there. Just tell us a little bit about your relationship to the public health field.
Yeah. So right now I work for a school of public health at a university. And in that school of public health, we have a center where that center is responsible for substance use prevention, do education, and we use all the mechanisms for substance use that are used in any public health practice or initiative. So substance use prevention is within the house of public health, and that's what I've been doing for over 2 decades. I've enjoyed every aspect of it, and it lines up perfectly with our topic today as we link it to social justice.
Mm-hmm. That's really good. So, tell us a little bit more about how you see, social justice issues, but really specifically, how do you see racism playing out in the field of public health, especially as you encounter it on a sort of on a day-to-day basis, and also maybe in a macro sense too. So sort of on that day-to-day sense, but also in that macro sense too.
Well, public health is the reason why right now so many of my folk are still hesitant with getting that vaccine for COVID. It was the United States Public Health Service that was the initiator of that Tuskegee experiment that we all know,
Wow.
and that was our government wanting to find out what happens to people who have been infected with syphilis. And you all know over 300 men that were told to come to this free clinic because they had bad blood and they were just monitored. They're supposed to be treated for syphilis, but they were just monitored and given placebos, and they just watched the course of that disease ruin those men's lives and that of their children and wives and families. And, that experiment went over 40 years, started in the 40s, didn't end until the 70s, late 70s.
Wow.
And that was part of our history with public health. But, that's just one of many. Then we took that same experiment and went over to various countries like Guatemala and also tested on STDs or STIs, which was important for them to find out what other venereal diseases and sexually transmitted diseases would do to people if untreated over the course of their life. But Martin, here's the thing.
Yeah.
We wish we could say public health was the only field that started that way. But as you know, a lot of fields in their history, whether it's medical, right, which we're talking about health and healthcare, a lot of the experimentation was done on people of color because their value, their estimation of who they were as within the degrees of mankind. They weren't considered as full humans, and therefore were expendable. And
Mm.
we were human enough to test on, just not human enough to have rights. So
Mm.
that's in the history and background of lots of sectors of communities, not just public health and healthcare, but we can look at certain types of experimentations throughout any other field, from finance to engineering. We can find any of those abuses falling upon vulnerable populations, as we call them in public health.
Mm. Well, man, thank you for sharing that history. I actually don't think I knew, specifically that public health was at the roots of Tuskegee. And, you said, I'm sure everybody knows about it, but I'm not sure everybody knows about it, especially young people might never have heard about it. And even if we have heard about it, we may not know that depth of some of what you just shared. And also that was repeated in other places around the world. Also, just quick moment for me, because I'm not sure I know what an STI is. I know what STD is. What's an STI?
Sexually transmitted infection.
Oh, infection. Okay.
Yeah.
So you have STD, sexually transmitted disease, and STI, sexually transmitted infection. Okay. Yeah. Thank you for sharing that, because I'm not sure 100%. I know I didn't know what it meant. So I assume maybe some of our listeners didn't as well. So, I mean, just taking a deep breath and, assimilating that information that you just shared, because that's heavy stuff, Albert, right? That, and it's certainly understandable why people would not trust healthcare in general, but public health specifically, because of that history, right? That history is very intense. That history is very intense. And, I'm also, do you know about any connections with the eugenics movement? Because I believe I've read also some connections with some of what was seen as public health. Like I know that, and I know this is controversial, but, on many levels, but the truth is that one of the people that helped start Planned Parenthood believed in eugenics, which would be considered public health. So this idea of like getting to good genes through public health, is that something that you've also, are familiar with at all?
Yes. Once again, that same pattern of a hierarchy of humanity, and those that are not considered as the desirables, maybe
Right.
considered the less desirables, therefore maybe shouldn't have as much opportunities to be within spaces as those that are the desirable population. So with eugenics, there were all kinds of testings, not just mentally, but also physically. They would check them and measure them and their everything from their width of their shoulders, height, all of those things link towards not having diversity, but having this ultimate standard of what a human should look like, and therefore anything with hair and eye color, all of that
Mm-hmm.
played into eugenics. Features, facial features,
Mm-hmm.
and so it's just an element of what they had considered a science, but
Right.
also spread throughout other forms of systems and institutions who also wanted to therefore have a standard. And then
Right.
they just link those standards to whatever the desirable features and context of what they considered a high ranking human to be. And that's what they
Mm.
based it off of. So we'll see that eugenics testing in education. We'll see it, of course, healthcare, but you'll see it in finances as well. Just more excuses to disqualify people from having opportunities to play on a level playing field.
Right. Yeah, yeah. Thank you for sharing that connection. What I'm really thinking about right now, Albert, is this idea that public health was infected by racism, if you will, right?
Yeah,
Like, that the the intent may not have been to harm, black folks or other communities of color here or internationally, but certainly that was the impact of it. And because, public health, like everything, every other system in this country has kind of racism kind of at its core, right? At its base and foundational level. How have you seen, because I know, I've been in relationships with folks in the public health field at University of Washington, masters in public health, did some work with them. And, what do you see right now as the movement to extricate racism from the public health field? What have you been seeing happening, and how does that affect the work that you do, and how are you a part of that?
Yeah. So, as we know, all of our lots of our systems and institutions began in a discriminatory place, based
Mhm.
off of segregation. And so mentalities of those leaders kind of set the tone and the pace. And
Right.
many of them, therefore, forged policies that were not based on the reality, more of based off of who was undesirable and not wanted. And then the policies, the consequences, the restrictions would lean towards whatever group that was.
Mm.
So we'll see that played out variously as it links to, certain states that want to have a move in a direction, or certain regions or cities. They could have a law that was against a particular type of element that a group might be into. So
Mm.
we know that, before the DEA, there was a drug agency, and the leader of that drug agency, and I'll think of his name in a little while, but his remarks are that he was against darkies, and so he made and was institutional in forming policies and laws that linked to marijuana use, because that was considered a drug of choice, that they considered that black people and Hispanic people wanted. And so he used that office to help get those laws passed that would cause that to be an illicit drug, and
Right.
therefore was able to cause the downpour and the outcomes that we see even now today, with
Mm.
millions of folk being locked away over those years from the 30s all the way up to now on marijuana use, when
Mm.
we know drugs that were more for the elite of the day, there were little consequences. You could be on Wall Street doing a whole kilo of coke if you want it. Nobody would
Right.
bother you. And so those are the types of things that we began in. But now, as people grow, and this is where I like to give grace, right? People and institutions are like people, because they're full of people. But
Hmm.
we may not start off the best. We can actually start off horrendous,
Right.
but people have the opportunity to grow. And so our field of public health grew as it allowed more diversity to come into play, where people could get positions after a while. Because up until then, it was still going to be dominated just by the majority populations. But as that diversity opened up, more people will be able to be included. And then those extremely brilliant folk could do what good public health does. And so here's what I like about public health now. Public health now is all about following the data, right?
Mm.
So data is the big pull now, and it has been. And so now we approach from an eye of, instead of me thinking about what the problems are, as I demonstrated with the historically, when that person was over the illicit drug program, where
Right.
he moved in a direction that he wanted to, based off of his hate for darkies. Hate to even use
Right.
that word, but that's his words,
Yeah,
literally.
it's quote unquote, right? I mean, it's
Quote,
it's the word he used, right?
was what he is remembered for now. Now it's coming out because it's had such a tremendous outcome, that people are now finding the words that were used in order to get the buy-in from the community and the policymakers to make those harsh laws that would do that. But instead of going that pattern over and over again where people are just following leaders who may have stigma and discrimination at their bases, which could lead to the destruction of certain populations. Now we follow data, and the data says whatever, if there's a problem behavior, does the data prove it? And if
Mm-hmm.
we find that there is data to prove it, either through going and finding out through the records of institutions that would, have a weigh in on the impact of what those populations are incurring. For instance,
Mm-hmm.
are we seeing an increase in deaths as a result of alcohol use? And is that alcohol use, therefore, is there data that shows that a lot of that alcohol use is resulting in people driving while intoxicated?
Mm-hmm.
And are those deaths also linked to accidents? So we can find data on all that. So if we're finding that data shows that there's a severity of its death for consequences, there's a high magnitude, we're having many of them which are occurring, and that the trend is that it's increasing, well then we will then, with public health, it says we'll find out what the risk factors are, what's actually underlying people getting involved in the problem behavior of drinking, as well as the consequences, which could be, death by, by accidents resulting from that. Once we do that, what are those risk factors? And risk factors are important because these are scientifically led, researched out factors that show that there's a link between a particular thing, and that
Mm-hmm.
particular thing alone leads to a likelihood of that substance use or whatever that problem behavior is. And so
Mm-hmm.
public health we're proud of because now we search things out through research, and then it's got to have a theory base behind it that can be shown, across other peer researchers who can verify each other and say, hey, I agree. Here's my findings after we've done multiple studies and longitudinal studies. We followed individuals out and showed that this one thing links to a higher likelihood. And then as a result of that, we choose to then focus on the risk factor. And that risk factor is what we're after. Instead of just
Mm-hmm.
going after the fruit, which was what we call the problem behavior or the alcohol use or whatever substance is being used, as we're linking this, think about heart disease, right, Martin? This is
Yeah.
easy to think about. I'll link it to
Yeah.
this and then I can move on. So, with heart disease, it's one thing to know that you're having a problem of heart disease. We can look at a city and say, wow, there's a lot of heart disease here.
Mm-hmm.
That will show up in various places. We can go to our hospitals and get de-identified data out that is not using the personal identifiable attributes of a person. It'll just show the data as it is aggregated over multiple cases, and we can say, wow, there's a multitude of heart disease in a city.
Mm-hmm.
Well, it's not good enough just to know that, because now if we want to do a strategy, Martin, that
Yeah.
strategy could be anything. Well, how are we going
Right.
to lower heart disease? Are we going to do it medically? Are we going to do it with some proactive measures? The
Right.
thing is, what's the risk factor that's linking to all this heart disease, that's
Mm-hmm.
causing all this heart disease? Then we could find out, oh, wait a minute. We found out that the link between these people that are having the heart disease problems, that they are having diets that are high in cholesterol. All right, so now we know that it's the high cholesterol, or the diet, rather. I'll just say it's the diet of the individuals. And then we look in those communities and find out, oh my, it's a food desert. And so
Mm-hmm.
the majority of the people are making choices that are fast food linked, because the nutritious side of food, which should be like
Mm-hmm.
the norm, is not. There
Right.
aren't those
Right.
many great supermarkets that have an opportunity for people to shop in those areas, or those areas are called what we call food deserts. So
Mm-hmm.
they're not close and people don't have great transportation. So what's around the corner? You've got your fast food chains and you have your convenience stores, and if people are hungry and they've got to either walk a block or two to that or try to find a ride 10 miles out or further,
Mm,
they're going to make
right.
that choice of what's most convenient. And so that's not a criticism of them and their decision making. That's an environmental problem. Therefore, it's a public health problem. So then
Right.
it's the duty of public health to realize ways in which we can bridge people closer to the desirable behavior, which would be we want you to make great food choices, healthy food choices. Now let's strategize how we can do that, how we can bring good food resources closer to the community as opposed to calling out individuals and just saying, man, you just got a bad habit of eating badly, you know, making people full of stigma, full of
Right.
all certain kinds of biases implicit, right? These people just don't want to eat well, and that's not it at all.
Right. Yeah.
So public health has made that turnaround. Also, I'll say the great leaders in public health are phenomenal. They are diverse. They get up there and they bring it because they realize that public health is neither good nor bad. It is
Right.
neutral, but it has great tools. And if good people were at the forefront, then we can do great public health work. That's with any entity and institution. And so right now, I think about the great one of them is called Nacho, and it's where the health departments come together, NACCHO. And so I may have gotten that wrong, but I'm not looking at it right now. But they have done great, tremendous work, and just so happy that they're bringing the data along with showing that racism is a public health problem. And they're
Right.
not the only ones. The APHA, American Public Health Association, they have also come out and stated that racism is a public health problem. And they
Yep.
have boldly proclaimed it as such, so much that it's the first thing you see on their website. and
Yep. Yep.
and they're making moves and have been making moves about this issue for quite some time now.
Awesome, man. Thank you for that. That was extremely educational, to just really make all those connections. So what I really hear you saying is that, once you get out of the individual blaming into the systemic reasons for why individuals, really the context. I've thought for years as doing this work around race and racism that so much of it is about context, right? That,
Mhm.
the context in which the individual makes the choice is extremely important. And so I hear you saying that once you do that, then you can really start to see how racism has been inherent. And also, once you start to get to systemic places, then you can really start to see racism as a public health issue. So that's really what I heard you saying. So here's my next question for you. So when you become mayor of Gary, which I'm pretty sure is going to happen in the next 4 to 6 years, when you become mayor of Gary, what would you do? Like when Albert gets some systemic power, right? And some relationship to systemic power, what do you do in order to really address both the racism in public health and also racism as a public health issue? What would you start to implement on a like personal level? You know what I'm saying?
Yeah. Martin, one of the components of public health is an element we call capacity.
Yeah.
And capacity is resources plus readiness. And that's what
Hmm.
equals capacity.
Okay.
And capacity, the resources are human, financial, and the other one is organizational. What racism does is racism affects at the capacity level populations that are being most impacted negatively. You will see that their capacity is extremely deficient. You'll
Hmm.
find that because what was the whole purpose behind racism anyway? Was to build a certain group to a higher level by actually taking resources from those that would not be allowed into that group. And then those resources would help to fortify the group to whom it was intended, while at the same time destabilizing, right?
Right.
Destabilizing the groups that were not a part of the majority. And what we have in public health is a capacity issue as far as when we're dealing with racism and we're dealing with communities that are in need. They've all been impacted in what we call the social determinants of health. And those social determinants of health are things like access to health care,
Hmm.
education. There's what we call the social context, which means do people feel welcome in their communities? Is there discrimination in their community? Then you also have the neighborhood and built environment. And then the other one is economic stability. And economic stability is the one that underscores all the other ones, determinants of health. So if I were and am to make a substantial change, a systems change, if I'm going to add one thing, I'm going to add capacity, and I'm going to add capacity around that economic stability, because
Hmm.
economic stability is the area that has most disadvantaged. The economic instability is the area that is most disadvantaged populations that have been discriminated against. And that's where you get the frustration. That's where you get the lack of opportunities. That's where you see the education on the decline. All of it is linked to the economic leg of
Hmm.
those social determinants of health. And so, what I want to do is build wealth, continue to build wealth. And the more wealth we're able to build, the more opportunities we're able to bring to our beloved communities that we know, Martin, are far more genius than the stigmas that are out there to say that they aren't.
Right.
And if individuals are allowed to therefore put their monies together and build all kind of great new institutions, businesses that will also create jobs, which is the big bottom line. And not I'm not, putting against low paying jobs, but we have to have
Right.
jobs in which people can sustain their families, as well as where people can take risk. Because if your capacity is low, that means your resources are low, which also means you have less chance and less likelihood of taking risk. Because Martin, if
Hmm.
when you
Right.
only got, and I'm gonna laugh, this is gonna be funny. If
Yeah.
you go
Yeah.
to the casino with $5,
Hmm.
you playing that penny machine,
Hmm.
and you're gonna be real. If you don't like that machine that you're on, you're not gonna sit there, and you're not gonna be like, well, let me ride this machine out. You're gonna be like, no, I only got $5.
That's
I
right.
need to go and let me hop on this other one. Whereas somebody who has play money that's in the hundreds or thousands even,
Right.
they can take more risk, right?
Sure.
Not to say that the person that has the $5 won't hit it big, right?
Mhm.
But as you all know, it's really about the long game, right?
Right.
Can you stand there long enough, like in the market, right? Stock market or commodities market? Do you
Right.
have big enough money, aka capacity, to stay in the game long enough to where your investment will end up paying off? Or do you have such little capacity that all you're ending up doing is putting money in for the person that's playing the long game, and then what you've invested ends up being reaped by those who had the capacity to stay in there the longest? So we got
Mm.
to endure in order to make this change, and figuring out ways of doing that is
It's
is where
beautiful.
my head is at right now.
Yeah. 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 No, that's beautiful, man. That really is. And I was laughing as you were talking because I didn't hear you say no. to you being mayor of Gary.
Oh,
So
let me say it now.
I don't know if this is no. I think this might be the official launch, right? Of
No.
the Albert for Gary Mayor.
Oh,
What
you trying to get me in trouble, Martin.
2024? Yeah. Make sure all your friends and family in Gary hear this. They all know you should be mayor. Everybody knows it already.
We got a great mayor right now. I'm not trying to do anything, but
okay, all right.
follow after
I got
his
you.
leadership.
I got you. So
Yes.
after this great mayor's, are there term limits?
No, we don't have term limits.
Oh, okay. All right. Well, then when the great mayor is no longer there, that's when you can run, right? When a not so great mayor comes in. I don't want to start beef with you and no beef with you and the aristocracy of Gary politics. So, I just see it. I feel it for you in the future at some point,
Oh, that's awesome.
But I just want to thank you so much. I mean, I think this has been an amazing podcast. As you really took us to school on public health and social justice in public health, and specifically, social justice in healthcare, specifically social justice in public health and how that relates to it, and also specific to racism and ways out of that. And I love your ideas. I think it's so much in line with what we talk about in Soul Focus Group, that we're much more powerful than we think we are, because we are the engines that generate that economic change that you talked about, and that's what's going to happen as we start to re-achieve, human solidarity, both with our, solidarity with ourselves and solidarity with each other inside of races and across races. So, what you just talked about, I think, is right in line with Soul Focus Group and what we do.
Yes, sir.
All right. Well, Albert, thank you. And we want to thank everybody for listening. As always, we're so excited that you all have made the decision to spend time listening to us. We're so excited that you've made a decision to come on this journey with us. We absolutely are excited to have you with us. We ask you to go to soulfocusgroup.com. We have so much new and exciting things that are coming. We can't wait for you to check it out, to see it. And we are going to restore health to ourselves and to this country. And we're excited to have you part of that journey of health restoration. So with that, we ask everybody to stay well, stay safe, stay healthy, and most of all, stay soul focused.